Hello and welcome to this fifth episode in our series on depression. In this episode, we deal with psychotherapy as a treatment option for depression. Come, let us meet our expert.
So psychotherapy is a form of treatment using psychological methods in which a trained mental health professional engages with the patient and enables the patient to overcome the symptoms and disability caused by depression. The trained mental health professionals who may administer psychotherapy include psychiatrists, clinical psychologists, psychiatric social workers, or other trained counselors. There are different techniques of psychotherapy for dealing with symptoms of depression administered at the individual, group, or family level. These techniques include treatments such as cognitive behavior therapy, also referred to as CBT, psychodynamic psychotherapy, interpersonal psychotherapy, group psychotherapy, family psychotherapy, other psychosocial interventions, and so on. These therapies are administered by trained mental health professionals over multiple sessions, each lasting 45 minutes to an hour, over 6 to 12 sessions or more, depending upon the needs of an individual patient. Amongst these various psychotherapies listed, cognitive behavior therapy is perhaps one of the most commonly used therapies for depression. Cognitive behavior therapy is aimed at enabling the patient to become aware of certain negative assumptions that they hold about themselves, their current situation, and the future, and the effect of these negative assumptions on their mood and behavior. The patient is taught certain techniques that will enable them to convert these negative thoughts into positive thoughts. This will lead on to improvement in their mood and behavior. The patient is also taught certain techniques to cope with their current difficulties better and also to solve the problems that they face on a day-to-day basis more efficiently.
This concludes our episode on psychotherapy of depression. In this episode, we learned about psychotherapy, different kinds, how they are administered, and focused a little bit on one of the important psychotherapeutic options for depression, that is cognitive behavioral therapy. We will be back with our next episode. Namaste.